what that video and other aspects of the training are conveying is what we would call kind of a paradigm shift, a different way to look at a kid's behaviors or a youth's behaviors, and for that matter, adults' behaviors. It's the idea that there is meaning behind behaviors and that there's a history behind those behaviors, so that what becomes important when we have, a bad actor, for example, or misbehavior, is not the question of what's wrong with you, which is, of course, the first thing we try to get to try and control a behavior, but instead the question of what's happened to you. Again, as stated earlier, not so that we as teachers or providers of care can diagnose what's wrong with a youth, but recognizing that something has happened and that we need to be supportive of that youth to help them so that they can make better decisions down the road. So when we're talking about building resiliency and fostering resiliency in our youth, what we are really talking about is setting up an environment where what we can do, what as the research calls, establish a caring adult. The research shows very clearly that one caring adult in a youth's life is the most resilience building factor for youth. So what does that look like? What that looks like is maintaining safety for kids, their physical safety, their emotional safety. It means empowering them to help them make decisions, giving them a voice when we can, a choice when we can. And I would say, when I say a voice when we can, it means a respectable voice. Really, even when they disagree, when we can hear them out, that is helpful to them because it shows them that yes, that what they say is meaningful. We may not be able to accommodate what they're asking, but it shows that what they're asking is meaningful. We give them choice when possible. And remember that misbehavior sometimes is also a choice. And that also leads us to the notion of expectations. That it's very important, because this is a common misconception, it's very important to maintain clear and consistent expectations. In these presentations, it's often asked if what we are saying is that kids, because they have a history of trauma, should just be able to run free. And nothing but the opposite is true. Because what you really need are clear, consistent, and fair expectations.